I'm Dr. Donald DeFabio with your wellness tip. Headaches are a very common condition that people present to the doctor for, probably one of the top 3 in any doctor's office. 83.7% of those headaches respond to a safe and natural modality. It's chiropractic. Dr. Joseph D'Angelillo of the Association of New Jersey Chiropractors. As a chiropractic doctor, do you treat headaches in your office?
Absolutely. Every day I see chiropractic patients in the office every day that have a headache, and probably every chiropractor in the state of New Jersey sees patients that have a headache. When patients have headaches, there's multiple causes for it, and everybody jumps to the brain tumor or that they've had a stroke, something like that, and certainly those are intense conditions that need to be addressed immediately, but the vast majority of headaches are what we call tension headaches or cervical related headaches, where the musculature of the neck or the nerve roots at the top of the neck become irritated, which then create the pain in somebody's head that they perceive as a headache. When a chiropractor examines a patient, they're primarily looking for irritation in the nerves in the upper part of the neck, whether or not there's any involvement there. The joints of the upper part of the neck can become stuck, and they can cause irritation directly to nerves that go into your head, or irritate the muscles in the neck, which then compress and cause that muscular type of headache. Mm-hmm. And the treatment that chiropractors will give is an adjustment, which can be varied from a soft tissue technique up to a more high velocity where you hear that clicking, cracking of the joint. Mm-hmm. It's the most common modality that we use in our office for treating patients with headaches.
Well, as chiropractic doctors, we look at the mechanical problem with the neck, with the spine, irritating the nerves, irritating the muscles. But what about dietary changes? What about lifestyle changes? Can people expect those types of recommendations to manage their headaches?
Absolutely. There are lifestyle things that people do that contribute to their problems, whether or not they have their computer set up properly. Are they, looking too far up, looking too far down on the computer? Is their keyboard, too high? Because all of a sudden they start raising their arms up, contracting all the muscles in their shoulders and their neck, which then influence the tension that they have in their neck. Certainly there are foods that people ingest that can contribute to a headache. So there's a whole multitude of causes to headaches. Chiropractor's role is, number 1, let's make the patient more comfortable, and then number 2, let's find out what's the initiating cause that's producing this person's headache. Is it a lifestyle change that they need to employ as well?
Mm-hmm. So finding the cause of the problem, giving the patient the tools to manage it, as well as alleviating any nerve irritation or muscular interference creating the headaches, does the trick.
Absolutely. We try to educate our patients so that they can help creatively solve their own problems many times. Doctor also means teacher, so many times we have to teach patients the right biomechanics as well as foods that they should be eating.
So there you go. Sounds like it's a no-brainer for me. Chiropractic care, and it's essential, it's important, and it works really well to help treat your headaches or a loved one's headaches. So if you do know someone who's suffering, consider that first before you reach for medication or, God forbid, a surgical procedure. I'm Dr. Donald DeFabio.